Healthcare can wipe out your savings faster than a market crash. If you're thinking about early retirement, watch this video first. Here's things that your financial advisor probably didn't tell you just because they're fairly nuanced. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am sipping on a bee's knees, and we're going to be discussing health insurance for those that retire before 65. Cheers. So before we dive into the options available for those of you that retire before 65, I want to go over a few stats and some facts with you. So first and foremost, the average retirement age in the United States is actually 62. And for those of you who have watched several of our videos before, know that Medicare actually starts at 65. So what we're going to be talking about today is obviously the gap that those 62-year-olds, what do they do until they turn 65? So a few things that are worth mentioning before we dive in is the median savings for an individual retiring today is $64,000. And on the other hand, Americans think they need about 1.46 or 1.5 million for retirement. And these are both from Investopedia if you're looking for sources. So, what are the reasons that most people retire early? Frankly, what we've seen here at our company is health reasons. Someone's planning on working longer than 65, but, something happens to them or their spouse that they need to be a caretaker, or they're just physically unable to do their job anymore. Additionally, there's been a lot of layoffs this year. A lot of people lose their job for one reason or another. Generally, when you're approaching retirement, you're more expensive because you've worked for longer. So companies sometimes eliminate the more expensive folks first. So job loss, is there something going on in your family? Are you planning to travel, or do you need to take care of a spouse? And then, the last one, of course, a lot of people retire early because they're financially ready. They've been saving their whole life for this. And frankly, this is not as common as it should be, but it's something that happens. We do see a lot of unexpected early retirements here. So kind of diving in now, some other costs that I think are worth mentioning. So an individual needs around $157,500 for health insurance from the time they're 65 until the remainder of their life. And that's a stat from Fidelity. And another important fact here is, let's say that your spouse is on Medicare and they're retiring, or you're covering them in some capacity, but you're not. So we do see a lot of couples that'll come to us where, one of them is 66 and one of them is 62. What do they do at that point to bridge the 62-year-old till 65? So we're going to kind of dive into what these options look like for those folks that are not yet 65 when they retire. All right, so first and foremost, probably the most prevalent option for individuals that retire before 65 is the Marketplace or the Affordable Care Act, the ACA plans. This is essentially healthcare.gov. So before I dive into this, I do want you to know that we have other videos on this. So go ahead and click here and check out, we've talked in more depth about this, but some important notes before we move on here. So these plans are federal or state. Some states establish their own state exchange. Some of them utilize the federal one. These plans are generally looked at as, if you lose your job, how I just mentioned previously, or something's going on in your situation that you're leaving work unexpectedly, you would be eligible for a special election period. And that's, like I just said, job loss if you move, etc. Aside from that, if you're existing on one of these plans or something else is changing, you have an open enrollment period every fall, like Medicare. It's November 1st through. Now, this is January 15th because that's what the most recent period was. But I'll be frank with you, this is changing a lot right now for the end of this year and moving into 26. So one of the things I've heard proposed for 2026 is that the open enrollment period will end on December 15th. More to come there, but just something worth mentioning. These plans do include a premium tax credit or a subsidy to help lower your premium, and it's based on income. So essentially those individuals that make less than 400% of the federal poverty limit are eligible for some help with their premiums. Now, I do really want to mention here, at this point, these subsidies are set to expire at the end of 2025, but I have been spending hours researching and listening to what both sides of the aisle are saying about this. And we will be putting out another video to talk about, what are the Republicans, what are the Democrats, what are they all saying about extending these tax credits? Because there is a lot of noise surrounding this. If they extend them, will they look the same? I don't know, but we will be getting you more information on this, just kind of explaining who's saying what and what we're anticipating for next year. But more to come on that. So these do include your premium or your pre-existing conditions, so those are covered, and your premiums vary based on several factors. Aside from even the premium tax credits, where you live, etc., a lot of that factors into the premiums. So what do these plans look like? Essentially, these plans are tiered. They're metal tiers. So first is the bronze. These are the lowest premium plans, but you pay the most out of pocket when you utilize your services. So essentially the least amount of coverage. The silver, they're kind of more evened out. The gold is the premiums are much higher, much less deductibles and out of pocket when you use your coverage. And the platinums, this is essentially the Cadillac plan, the highest premiums, etc. One important thing to note about these plan tiers is that they are not available. Not every bronze, silver, gold, platinum is available in every single state and area that you live. So it really sort of depends on what your options are, where you're specifically located. So that's the ACA or the Marketplace healthcare.gov plans. We want to pivot now and talk briefly about the short-term plans. Now, these have changed a lot over the last few years. So the way that these currently work is that they last up to 3 months. So they're truly a bridge between maybe, you need something to cover you for 3 months or something's going on there. So they last up to 3 months. These are less expensive, but they do not cover pre-existing conditions. Not everyone's going to be eligible for these plans. They have limited benefits. It's not full comprehensive coverage, so it's not covering everything. In addition to that, they may have high deductibles, out-of-pocket maximums. There's a lot less certainty when it comes to these plans because they're not as government regulated as the ACA options. All right, one more option that I think is worth mentioning, because we do get questions on it quite frequently, is the health sharing concept or model. And we see a lot of this from a community-based or a faith-based organization, something along those lines. And basically what this is people are pooling their resources or their dollars to then pay medical expenses. So it's essentially not insurance. You don't have to cover pre-existing conditions. There's no guarantees. It's not going to cover smokers or people with a history of alcohol abuse. But the one here that I really want to mention, because a lot of these plans that I've seen, they do look like solid options. But the biggest thing that concerns me here is they may cap the cost. So a lot of the plans that I've seen, there's a maximum that the pool or the community would essentially pay. So if you're in the hospital for an extended period of time, we all know that hospital bills get very expensive. So this is something that's worth keeping an eye on, and I find it to be a little concerning, is they have a maximum they'll pay for things. So there are, these have worked for certain people, but there are some concerns that I have when it comes to these health sharing models. All right, so before we dive into wrapping it all up, let me take a quick sip here. All right, so just to kind of recap what I've just talked about, because there's a lot of information in a short period of time here. I'm going to just overview the ACA, the short term, and the health sharing, and kind of compare and contrast all of them. So essentially, first and foremost, and during the Affordable Care Act and healthcare reform and everything, we all know pre-existing conditions was something that was a hot button issue. So it's worth really keeping an eye on. ACA, the Marketplace, will always cover pre-existing conditions. That's one of the big perks of the Marketplace. Short-term plans will not cover it. Health sharing, maybe. Frankly, it varies by the plan that you're on. It's worth really reading the fine print and taking a look at. Next is the essential health benefits. There's a list of what these essential health benefits are. You can Google it. You can look it up online easily. But essentially what they're saying is that every plan that's considered comprehensive should cover all of that. Now, obviously the ACA or Marketplace will cover that because it's sort of when this came about. Short-term plans do not cover this. And health sharing plans, it's limited. From here, the monthly cost, I'll be frank, the ACA, it is expensive, especially if you're not getting any of those premium tax credits or the subsidies. You could pay a lot for these. Now, if you work with a financial advisor or an accountant or something, I would highly recommend you have a conversation with them, because there are strategies and ways to lower your income, if that's an option for you, to take advantage of some of these subsidies. A lot of people, if they're no longer working, would be eligible for them anyway. It's just something that's worth really kind of doing your homework and your research on this. Short-term plans, they're going to be less than the marketplace, but you're still going to pay a decent amount for them. And the lowest cost would be the health sharing plan. The enrollment periods, the ACA Marketplace, I just talked about this. Every fall, you can select a new plan for the following year, or if you lose your job or there's some type of qualifying event, you can have an enrollment period in the middle of the year. Short-term plans you can enroll in anytime, as well as health sharing plans. And last, the consumer protections. The ACA Marketplace, it's strong. There are millions of people on these options. Sometimes they say there's safety in numbers when it comes to something like that. The short-term plans, there's minimal consumer protection. We're only looking at 3 months here. That's how long you're going to be on this plan for the max. And when it comes to the health sharing plans, there's really none. You're working with the organization that you got the plan through. You guys are pooling your money. It's just a far different situation. So if you're planning to retire early, or frankly, if you already have retired early, let us know in the comments why. Was it something that you planned on, or was it something that just happened to you? At the end of the day, retirement is not a requirement when it comes to Medicare. These are obviously all of the options for you if you retire before 65. But don't wait. You've worked too hard to let healthcare be the thing that delays you from the life that you've dreamed of and everything you've wanted to do in retirement. So let us go ahead and assess your options for you. A lot of times these options are more affordable than people think they are. And by making a plan, you can even bring some of those costs occasionally down a little bit more. So at RetireMed, we help individuals understand their options and work with them to find the right coverage for their needs. So cheers to you, and thanks for being here with us today.